Hi friends, good evening. Once again, welcome back to my channel Mookambika Nursing. Friends, we are discussing important questions for RRB Nursing Superintendent exam and also other nursing officer exam. Most probably RRB Nursing Superintendent exam we can expect December or January month. So, study well for the exam. I am also preparing questions. If it is useful for your studies, please subscribe my channel and support me. First question, which of the following would be most appropriate for the nurse to wear when providing direct care to a client with influenza? Our options, option A mask, option B gown, option C gloves, option D goggles. Here the question is, when giving direct care to a client with influenza, which one is the most appropriate? Which is the most appropriate thing the nurse should wear? Among this option, which is the most appropriate thing? Here we can see, if the nurse is providing direct care to a client with influenza, should wear a mask because the virus is spread through the respiratory tract. So in order to prevent getting of infection to a nurse, she should wear mask. Okay. The causative organism of influenza is influenza virus or orthomyxovirus and the incubation period is 18 to 72 hours. So here the correct answer is option A, mask. And the next question is, a client is admitted to the acute care unit. Initial laboratory values reveal serum sodium of 170 milliequivalent per liter. What behavior changes would be most common for this client? A client is admitted to the hospital and in his lab value or laboratory values reveal serum sodium is 170 milliequivalent per liter. Normal value of serum sodium is 135 to 145 milliequivalent per liter. Here this is hypernatremia. Hypernatremia means serum sodium level will be more than 145 milliequivalent per liter. Here the patient value is 170 milliequivalent per liter. So in this case, we have to monitor the cardiovascular, respiratory, neuromuscular, cerebral, renal and integumentary changes. Okay. In central nervous system changes, mainly the patient may have agitation, confusion, seizures, lethargy, stupor, coma. These all will experience. Here we can expect the answer is option B, mania. First option anger, then option C depression, psychosis will not be come in case of this hypernatremia. So the answer will be in mania, option B. And the next question is, the nurse is caring for a client with epilepsy who is being treated with carbamazepine. Which laboratory value indicate an adverse effect of the medication? Options, option A uric acid of 5 mg per deciliter, option B hematocrit of 33%, option C WBC 2000 per cubic millimeter, option D platelet 1.5 lakh per cubic millimeter. Okay, the question is, a nurse is taking care of a patient with epilepsy and the patient is taking carbamazepine. Carbamazepines are anticonvulsants. Among this option, which lab value or which laboratory value indicate the adverse effect of this carbamazepine? Adverse effect means negative effect or harmful effect of this medication. That is for carbamazepine. Here we can see an adverse effect of this carbamazepine is decrease in WBC count. So in our option, WBC is 2000. So one of the side effect is decreased WBC count. So the correct answer is option C, WBC 2000 per cubic millimeter. Move on to the next question. A client is admitted with a Ewing sarcoma. Which symptoms would be expected due to this tumor's location? Options, option A hemiplegia, option B aphasia, option C loss of balance, option D bone pain. Here the diagnosis of the patient is Ewing sarcoma. Ewing sarcoma means a type of bone cancer. Here we can see Ewing sarcoma is a bone cancer that usually in the flat bone. So it is a bone cancer especially occurs in the flat bone, especially like ribs and all. Okay, so in this case, among this our option bone pain we can expect to a patient with Ewing sarcoma. Hemiplegia will not come, aphasia will not come, loss of balance will not be come. Okay, the correct answer is option D, bone pain. Our next question is founder of Red Cross is options. Option A, Henry Dunant. Option B, William Eathoven. Option C, General Esmach. Option D, Robert Koch. Who is the founder of Red Cross Society? It is Henry Dunant. Option A is the correct answer. And the second option, William Eathoven is the founder of ECG, electrocardiogram. And option C, General Esmach, gave idea for first aid. And option D, Robert Koch, is the father of bacteriology. And also Robert Koch gave so many facts. In that, first one is he is the father of bacteriology, and another one is he discovered Vibrio cholerae, Andras bacilli. And the next question is Red Cross was started in the year. Options. Option A, 1877. Option B, 1859. Option C, 1920. Option D, 1901. Red Cross was started in the year 1859. Option B is the correct answer. And the next question, Red Cross Society of India was established in the year. Options. Option A, 1917. Option B, 1877. Option C, 1920. Option D, 1947. Red Cross Society of India was established in 1920. Option C is the correct answer. Red Cross Society was started in 1859, but in India it was established in 1920. And the next question is alteration in mood and affect consisting of sadness appropriate to a real loss is termed as. Options. Option A, apathy. Option B, labile mood. Option C, grief. Option D, depression. Here the question is alteration or changes in the mood and affect. It is mainly due to real loss in the life, especially real loss of family members or real loss of money or real loss of some personal things. That is known as a grief. Option C will come correct. A grief means a depressive symptoms due to actual loss of money or family members, etc. So the correct answer is option C. And the next question is formation of cavities filled with fluid inside the spinal cord is called. Options. Option A, meningocele. Option B, syringomyelia. Option C, meningomyelocele. Option D, myelocele. Question. Formation of cavities which is filled with fluid inside the spinal cord is known as syringomyelia. Option B is the correct answer. Move on to the next question. Adrenal function is affected by the drug ketoconazole, an antifungal agent used to treat severe fungal infection. How is this effect manifested? Options. Option A, ketoconazole suppress adrenal steroid secretion. Option B, ketoconazole destroy adrenocortical cells. Option D, ketoconazole increases adrenocorticotropic hormone. Option D, ketoconazole decreases duration of adrenal suppression. Here the question is adrenal function is affected by the drug ketoconazole. Ketoconazole is an example of antifungal drug which is used to treat fungal infection. Okay, so this drug is affected the adrenal function of the patient. So how we can manifest this is affecting the adrenal function? Here we can see the mechanism. Ketoconazole suppresses adrenal steroid secretion and may cause acute hypoadrenalism. So it will suppress, this drug will suppress the adrenal steroid secretion and cause hypoadrenalism. The adverse effect or the negative effect will be reversed when the drug is discontinued. Here, so the correct answer will come option A. Ketoconazole suppress the steroid secretion. Option A is the correct answer. Move on to the next question is, as the nurse assists the post-operative client out of bed, the client reports having gas pain in the abdomen. To reduce this discomfort, what should the nurse do? Options. Option A, encourage the client to ambulate. Option B, insert a rectal tube. Option C, insert a nasogastric tube. Option C, encourage the client to drink carbonated liquids. Here the question is, during the post-operative period, that is after surgery, a nurse assists the client out of the bed, or she is or he is helping the patient to come out from the bed. Okay, during that time the patient is reporting that he is having gas pain or pain in the abdomen. Okay, like gas pain. So what the nurse has to do first in order to reduce this discomfort, what the nurse can do? Okay, she should encourage the client to ambulate, or she should encourage the client to walk. Decreased motility is one of the main reason for abdominal distension or gaseous distension. In order to prevent that, nurse can encourage the client to do some active movement or encourage the client to ambulate. Okay, so here the correct answer is option A. Today we discuss some of the important questions. Surely the questions will not be very easy. Mixing questions we can expect. So work out with previous question papers and do hard work for RRB Nursing Superintendent exam.